Our objective for today is to compare the different cestode infections based on their source of infection, mode of transmission, and characteristic manifestation. We are going to discuss the ineffective stage and intermediate host of a common cestodes, and discuss cysticercosis and its management, and describe the hydatid cyst disease and its complications. Cestodes are worms that belong to the phylum Platyhelminthes or flatworms. Cestodes are commonly called tapeworms because their bodies are divided into segments which are called proglottids. These are hermaphroditic worms, with each proglottid containing both male and female reproductive organs. Hence, each proglottid is capable of laying eggs. These worms also have an organ of attachment called as colex, which helps differentiate one from the another. The tapeworms can be divided into two major groups, which are intestinal and extraintestinal. Intestinal tapeworms are characterized by having an animal intermediate host, which are cattle, pig, fish, and beetle. Humans serve as a definitive host. On the other hand, the definitive host for the extraintestinal tapeworms, Echinococcus granulosus, is an animal, commonly dog, while humans serve as accidental or dead-end hosts. Now, we are going to identify the source of infection, mode of transmission, and characteristic manifestation of parasite. Taenia saginata, source of infection, beef. Mode of transmission, ingestion. Characteristic manifestation is abdominal pain, nausea, and diarrhea.
Hello everyone, I'm Desiree Viloria and I'm reporting about Taenia solium, a tapeworm that can be parasitize people and can be contracted from undercooked or infested pork. It is found nearly worldwide because pigs are the intermediate host of the parasite. Poor sanitation leading to environmental fecals contamination is a major factor of this transmission. And this is simple explanation of life cycle of Taenia solium. People eat raw food or undercooked pork containing cysts of the tapeworm larva. In the intestine, cysticerci mature into adults which attach themselves to the wall of the intestine. Adult worm produce segments that bear eggs called proglottids, which may release eggs or detach from the tapeworm. The fourth stage is eggs or detached proglottids are passed into stool. Pigs or peoples are infected by ingesting eggs or the eggs-bearing proglottids. Eggs develop in the smears which invade the wall of the intestine. The smear travel to the muscle and the other organs and develop into cysts. And the second is Dipylobatrium latum. Dipylobatrium latum, the largest tapeworm that can infect people. And the symptoms can include abdominal discomfort, diarrhea, vomiting, and weight loss. The risk of becoming infected with this Japanese tapeworm parasite is the most prevalent when consuming raw or undercooked fish, particularly in the dishes such as sushi, sashimi, and ceviche. Infections may be long-lasting, persisting for many years or decades if untreated. Thus is the life cycle of fish tapeworm. First is egg release, Coracidae. Coracidae are ingested by cookpad. Coracidae become procercoid larva. Cookpad is indigested fish release larva. Procercoid larva become plerocercoid larva. Human ingest fish and plerocercoid. Plerocercoid matures to adult, live in the small intestine, release eggs, and the egg pass in feces.
Everyone, I'm Princess Diane Pilien. My report for today is all about the parasite, the source of infection, the mode of transmission, and characteristic manifestation. We have Hymenopes nana, source of infection, infected human. Mode of transmission, humans can become infected by direct ingestion of eggs. Characteristic manifestation, symptoms may experience nausea, weakness, loss of appetite, diarrhea, and abdominal pain. We have Echinococcus granulosus, source of infection, eggs from infected dogs. Mode of transmission, ingestion. Characteristic manifestation, symptoms may experience cough, chest pain, and shortness of breath.
Good morning, my name is Jerlyn Ramon, and our topic for today is all about cysticercosis. What is cysticercosis? Cysticercosis is a parasitic tissue infection caused by larval cysts of the tapeworm Taenia solium. These larval cysts infect brain, muscles, or other tissues, and a major cause of adult-onset seizures is most low-income countries. How it is treated? Infections are generally treated with antiparasitic drugs in combination with anti-inflammatory drugs. Surgery is sometimes necessary to treat cysts in certain locations when patients are not responsive to drug treatment or to reduce brain swelling.
Good
morning everyone, I am Blessing Lorenzo and I will be discussing to you what is the hyatid cyst disease. First and foremost, echinococcosis is a parasitic disease caused by infection with tiny tapeworms of the genus Echinococcosis. Echinococcosis is classified as either cystic echinococcosis or alveolar echinococcosis. A cystic echinococcosis or the CE is also known as the hyatid disease. This caused by infection with the larval stage Echinococcosis granulosus, a 2 to 7 millimeter long tapeworm found in dogs, definitely the host, and sheep, cattle, goats, and pigs, which are the intermediate host. And although most infections in humans are asymptomatic, hyatid disease causes harmful, slowly enlarging cysts in the liver, lungs, and other organs that often grow unnoticed and neglected for years. How is hyatid cyst diagnosed? This diagnosis is most easily set by the ultrasound or other imaging techniques such as CT scan or MRI combined with case history. And lastly, how it is treated. Percutaneous drainage with albendazole therapy is a safe and effective alternative treatment for hyatid cyst of the liver. Radical surgery with the pre- and post-operative administration of albendazole is the best treatment option for liver hyatid cyst due to low recurrence and complication rates.
What complications can occur in hyatid disease? The complication occur because the involvement of the liver may result in obstructive jaundice. Patients with lung involvement may manifest with cough, chest pain, and shortness of breath. Other organs that may be infected include the spleen, kidneys, heart, bone, and central nervous system, including the brain and the eyes. Cyst rupture may lead to anaphylactic shock, leading to death of the patients. The next in Tinosoleum parasite. Tinosoleum parasite has common name fork tapeworm, infective form with cysticercus cellulose, and the intermediate host is pig. And the characteristic of this is seizures, headache, and vomiting.
Good morning to all of us. My name is Shireen Laja and my report is all about Taenia saginata and Dipiloborium slatum. Taenia saginata or beef tapeworm cattle is the intermediate host of the parasite where the eggs enter the blood vessel within the intestine. The egg is transported to the skeletal muscle of the cattle to develop into cytosine or infective larva. The egg of Taenia saginata are distinguishable from Taenia solium and differentiative by their scolex and proglottids. The scolex are neurostellium and proglottids are rectangular and contain more uterine branches. The disease called taeniasis, where the majority of patients are asymptomatic, and those with high worm burden may complain of diarrhea, abdominal pain, loss of appetite with resultant weight loss and body malaise. And the laboratory diagnosis is the examination of fecal specimen from infected parasites. Dipilobotrium latum or a broad fish tapeworm. The adult worm is ivory colored and measures up to 10 meters and more. The scolex of this parasite is small, spatulate with dorsal and ventral median longitudinal sucking groove. Intermediately behind the scolex is an unsegmented neck. The egg or ova discharge periodically through the uterine pore, and a single worm may discharge as many as 1,000 eggs daily.
Life cycle of the beef tapeworm Taenia saginata. Infection by ingestion of undercooked contaminated meat containing the Cysticercus larva. Life cycle of Dipilobotrium latum. The adult worm self-fertilize and the eggs are passed out with the stool. If the eggs come to contact with fresh water, the Coracidium hatches is ingested by the first intermediate host, a tiny crustacean called a copepad. After ingestion, the Coracidium develops into the larval stage called the procercoid. The copepad is eaten by the freshwater fish, which is the second intermediate host, where the procercoid develops into the plerocercoid. Definitive hosts for the parasites are human and other fish eating mammals such as dogs, cats, bears, and seals.
Good day to everyone, I'm Catherine Omabini. Today, I'll be discuss the infective stage and intermediate host of common cestodes to the other parasite. I'll be assigned in the Hymenolepis nana. The common name of this parasite are dwarf tapeworm. It's the most common tapeworm recovered in the United States. It has a worldwide distribution and it is also found in East Asia and the Philippines. In the infective stage, gain entry after ingestion, the eggs transform into cysticercoid larva. Larva natures into adult capable of self-reproduction, and the eggs released after disintegration of the gravid segments. And the intermediate host of this parasite, it is different from other tapeworms because it does not require an obligate intermediate animal host. And the last is Echinococcus granulosus. The common name of this parasite are dog or hydatid tapeworm. It is a common of Asia, Africa, and Europe. The infective stage of this parasite is hydatid cyst. This is the diagnostic stage of the parasite, is its larval form, which is encased in a cyst wall. And the immediate cause is the dog acquired the parasite by eating the visceral organs.